Okay, so in today's video, we're going to be doing some techniques for chest tightness and tension that's related to anxiety. So people who are carrying around that restriction in their bodies up high, where you feel like you can't take a full breath in when you start to get anxious, or you just feel like you can't breathe, or you have palpitations. This is going to be kind of some body work maneuvers to be working with that area. We think of the heart and the lungs in the upper jaw, so the upper part of the body here and the chest. It's kind of what we're going to be working with unraveling today. And it's going to be a few different myofascial techniques, stretches, as well as some fluid pumping dynamic motions to help get everything mobilized, moving, and freed up. So let's go ahead and get started with our first technique. So our first technique is going to be a neck traction with one hand underneath the base of the head. So we're going to be placing one hand right underneath that occiput area, rolling head back to center. And then our other hand is going to be coming right on the center of the sternum with our fingers pointing down, straight down towards their feet. And so we're going to be placing either the tips of your fingers. If you are working on someone who might have breast tissue, this can be really just a good point to stay up higher. Or if you have someone that you're really extremely comfortable with, feel free to place a whole palm down on the center of their chest. Again, staying on the sternum, not on the actual breast tissue if there is any there. So what we're going to be doing here is the neck traction part is coming from the bottom hand. So this hand is going to be gently pulling her neck towards me, towards you, but very subtly. So we're not yanking on the neck at all, but you can even see that when I do a gentle pull, her whole body kind of flows with it, and then it relaxes down. So I pull and relax down. And you can think about using your body here to be the anchor that pulls rather than using your arm muscles, okay? But most of the work is going to be coming from our top hand here. So we're working on, like I said, the chest, which is the Ren channel meridian, the conception vessel, and the energy of that flows downward. The center of the body goes down. So we're kind of increasing the flow, the circular flow of chi by doing this technique as well. So Ren channel flows down the center of the midline. The Du channel, which is along the spine, governing vessel, goes up the spine, up the back to the top of the head. So as we're pulling, we're kind of increasing the flow of the Du channel with the bottom hand here, and then we're circulating and continuing the flow of the Ren channel downward. Also covering a really important point called Ren 17 on the center of the chest in the fourth intercostal space that can be really good for unbinding the chest. Again, for difficulty breathing, anxiety, it is this kind of the influential point of chi in the body. So this is going to be working from a few different angles really, really well. It's also just a general myofascial hold that can feel really beneficial for overall tension in the neck and upper chest area. So we're going to be pushing downward gently with our top hand down towards her feet, and then a gentle traction with my bottom hand here up towards me. And what I want you to do here is to relax into it with yourself. So like your hands are meeting and kind of sinking in with the body. And you might start to feel that your top hand sinks in naturally down towards the table more and starts to feel like it's being pulled down towards her feet more as the tissue starts to unravel a bit. So just go with that, not pressing further or harder into it, but just following whatever you feel and continuing to keep your bottom hand on the neck as an anchor point. Most of the movement is going to be coming from this top hand here on the chest. And you're just going to hold here for a couple minutes. You can do 2-3 minutes, maybe even longer if it feels good to your partner. You might start to feel a pulsation in one or both hands. Right now I'm feeling that pulsation in my bottom hand here, the one that's cradling her head. And that's a really good indicator that you have an arrival of chi, that things are moving, energy is dispersing, and fascia is starting to open up. You might get some deep breaths just like that. So stay here a few minutes or beyond if you communicate and your partner wants to keep going. And then when you're ready to come out of it, we're going to very slowly back out the same way we came in. You see my hands are coming closer to each other. Top hand lifts. Lastly, bottom hand comes off. For this next part, we're going to be doing a pec press and pulsation. So what this is going to look like is you're going to find the collarbones on either side of your person, and you're going to scoop your hands right underneath the collarbones, one on each side. And then you're going to stand up for this one. If you're on a table, this works really well. If you're on the ground, you can just kneel above your partner. So what I'm doing here is I'm finding, and you can press a few times, just kind of like bear paw your way around the upper chest muscles here. And again, being mindful to stay away from any breast tissue. And so what I'm doing is I'm finding a place in the deltopectoral groove, so right at that corner crease of the pecs into the collarbone, where it meets the shoulder. That's where the heel of your hand is going to rest. So right heel of hand into the right one, left heel of hand into the left one. And you can interlace your fingers or just kind of stack them up on each other. And you're just going to find a place where you can sink in, walk your hands around, maybe press and hold, have her take a breath in against my hands as I hold weight. And then as she exhales, I sink in with her to find a new minimum point. Then I hold that, breathe in again. And out as I sink in again. Finding a new minimum point, and one more time. Good. And you can do that a total of 3 times, that sinking in, with the pressure of going down towards the table, but mostly going towards the feet, okay? And so from here, standing up, we're gonna keep that same force of pressure going down towards the feet. We're gonna pulsate. So we're gonna have even pressure, heels of the hands, palms of the hands, and then the fingers. And we're gonna start to do full body pulsations. So I'm using my core, my legs, my feet. That's where my power is coming from. My arms, if you can see, are stacked with their joints, shoulders, elbows, wrists. That's not where I'm not pushing with my forearm muscles or my shoulder muscles. They're just staying stacked and relaxed. And I'm using my chi, the center of the core of my body, to pulsate. And you can see her whole body is going with it. This feels so good to pump, like we talked about, the fluids in and around the lungs, the lymph. It feels really, really powerful for kind of opening up the breath. And you're going to do this for about 2 minutes. I'm not going to do that a whole time here, but you keep that beat up. You can do about 100 a minute if you think of that, or 100 to like 120 taps per minute here. Okay. Another key component here is going to be working on the SCM muscle, so the sternocleidomastoid muscle, which is really important for vagal tone, vagus nerve function. So this one is not technically a chest, but it is connected to the chest. It comes down to the sternum here, and the clavicle has 2 attachments, one on the sternum, one on the clavicle. So very influential for the chest, but it is a neck muscle. So how you find this is you just come to the corner of the jaw, and if you turn their head and you have her resist your hand by lifting the head up, lift your head up, you can see the muscle pop out. Go ahead and relax. That's the sternocleidomastoid muscle. So you have your outline of what you're going to be working on here. And this can look pretty simply. Just start by doing some gentle circles. Stay gentle in this area. Don't go deep pressure. And you can just kind of work the tissue around that attachment on the jaw. And this can look like just stripping the muscle, again, gently, all the way down to the center point. So you're going to strip all the way down to the center here. You can see my attachments right here. That's where you're going to bring hands down to the sternum. You can do that a few times, stripping. Make sure to do both sides. And then you can also, if you turn their head slightly toward you, that gives you a little lax in the muscle and you can actually grab hold of it. So finding the point at the jaw, here's the back posterior side of the muscle. I have my fingers on that and then my thumb's going to come to the front. And you can grab the whole meat of that muscle and kind of work it back and forth. Pull gently towards you. Press gently down towards the shoulder and the chest. Again, just finding where it feels stuck, lifting it up and freeing it with some movement side to side, up and down. Working your fingers as far down as you can go along this muscle. Some people are so tight that you can't really even grab the muscle, so just be mindful of that. If that's the case, you can still get some good work by superficially stripping downward and doing some circles up top and doing some circles at the bottom where it attaches. Stubborn pecs want to get kind of manhandled sometimes. You don't get this in every massage. So this is a good technique, pretty powerful. What you're going to do is you're going to come to the inside where the pecs attach at the shoulder. And what we're going to be doing, I show you on myself, you're going to be kind of sandwiching the pec. You're going to be grabbing. So from underneath the armpit, you find where the pec ends. Make sure you're not pressing into the really vascular, nervy area here in the inside of the armpit. You're going to be finding the edge of the pec. If you need to have them double check the pec, you can have them press their arm against you. So press your arm down against my arm. As they do that, that activates the pec muscle and you can find where the edge of it is. Okay, so you can relax. And what you're going to do is you're going to sink one hand in underneath the pec and you're going to grab it like a sandwich. So it looks like on me, again, finding the edge of the pec, going to grab it, hold it like a sandwich, and then you're going to move it back and forth, up and down, all around, grab different areas. Okay, so back to our model. I like to come underneath the arm because then you can kind of move around and they relax their arm. But I like to do bottom hand. So the one that's closest, if it's a one to the breast tissue, I like to keep that the pinky side edge. That's a lot safer. And so you're going to grab with your thumb first underneath the pec. Then you can grab with the other hand. Grab, lift, and pull. Grab, lift, and pull. You don't have to do it with two hands. You can do it with one, but it makes your life easier to do with two. And again, you're kind of working it in towards the neck and back, lifting and pulling. So from a different perspective, coming in, finding the pec, going underneath with the thumb, grabbing with the fingers up top, working it back and forth. Working it back and forth. Grab, lift, pull, push, swerve it around, swerve it around. And then after that technique, bring that same arm out at a 90-degree angle. You're going to press down on the pecs here with your hand cupping the shoulder and go waving back and forth with the arm. Do a couple different spots. You can even bring their arm actually up overhead as you press. Press with the bottom hand, lift with the top hand. And just kind of work it with around the shoulder attachments there. Make sure your person is in tune with what you're doing too. There you go. Okay, so we're going to do a pec stretch after our work. You can have your person sit up for this one. If they're in a chair with a front or back, make sure they don't have a back because they're going to be moving them back. So go ahead and have your person bring their hands behind their head and interlace their fingers like so. And then what you're going to do is you're going to come behind them and you can just do the simple version of hugging their arms, letting them lean into your chest and lean back. Hopefully your chair doesn't have wheels like ours. disasters waiting to happen. Or if it's more available, you can do a foot and a knee up along their spine, like so. And you can grab from above their arms, embrace, pull, and let your knee kind of press into their upper back. Increase the stretch there and hold for a few seconds, a few breaths, and release. Go ahead and give that one a try. Okay, so this one is going to be pretty straightforward. We're going to be doing a diaphragm hold. So this is another myofascial release technique. And the diaphragm, we all know the diaphragm being the muscle, the breathing muscle that comes under the rib cage. But energetically, there are multiple diaphragms in the body. So we can think of these as kind of pivotal points of energy below and above, almost like keys that we unlock that can help the flow of balance above and below. So we have diaphragm that is in lower belly. We have the actual diaphragm. There is another diaphragm right at the base of the neck where the chest begins. And then from a more Eastern perspective, if we call these, we can think of them as the dantian, so like the elixir of life, where we hold our vital life force energy. Again, we have the dantian, main one below the navel. We have one in the upper chest, and we also have one in the head. So with all that said, we're going to be, for the chest tightness and anxiety, it can feel really, really beneficial and healing to hold these points from in front of the body and one hand below the body. So it looks pretty simple. What we're going to be doing is putting one hand on top of the actual diaphragm, which is right below the ribs in the center. We're going to be holding. The other hand is going to come mirroring that to the opposite side of the body, so on the back. You're not going to be holding your own, but that's just for a visual. So I'm going to bring one hand underneath my person to their mid-back, right below the actual diaphragm where my top hand is going to go. And you can relax your fingers into this. We're not pressing, pulling, we're just holding. And the idea here is to, if you can, close your eyes and really picture the energy here, almost like an orb. You can picture it with colors, any details you want to put in there. But if we think of this orb from the deep inside of the core, kind of growing and shining outward. That's what we want to use with the power of the mind here. With the hands, we're following. We're feeling how they move. See, my top hand is already kind of circling as I'm holding. The hands will become a mirror for the fascia. The fascia wants to move if we listen to it. So as we listen, we can be guided and go with it. And that might look like some little circles or waves. There might be nothing at all. But as you visualize the orb, bring that into your body by feeling. See if you can feel the orb connected from your top hand to your bottom hand. The power, the essence between your hands. Pick up on that as you're here. Harness it. And just hold it. Sometimes the body just wants to be held. And so for here, you can stay 2 to 3 minutes again, or longer for your person. Start with this one. When you're ready, come out, and then move up to the next one. So the base of the neck. I'm going to bring one hand right underneath, like C7 area, T1 area. So the base of the neck with one hand. Other hand is going to cup. So this part can be a little tender for people who have throat issues, thyroid issues, anything where their neck doesn't like to be touched. This one you can just kind of cup the area. You don't have to put direct pressure with your palm down. And I'd recommend to maybe keeping your thumb in towards your hand rather than straddling the neck. That can feel a little strangulating. Keeping thumb into your fingers. And again, you're going to do the same thing here where you're connecting and harnessing with the power of the orb between your hands, following any movement that the fascia wants to pull you through, and just breathing with your person. Okay, again, 2 to 3 minutes there. You can stop there. If you want to go a step higher, come to the top dantian. So this is going to look like the forehead. I'm going to bring one hand underneath, guide your hand under there so you don't kind of get the neck messed up. It might feel better to sit from the top of their head like I'm doing, how I switched here. One hand is going to be, again, cradling the base of the skull because it can feel awkward to have your hand any higher. And top hand is going to crisscross, go onto their forehead, sink in, click in, connect. Same thing, you're going to sit here, close your eyes, visualize, breathe, and feel the connection, what's going on in between your hands. This one tends to be a lot more of an enlivened area to hold, just because of so much head energy that we hold in our society of overthinking and just racing thoughts. You might pick up on that here with your hands. You might feel temperature changes. You might feel twitches, pulsations faster than usual. And that's all okay. Just check in with your person as you go. And when you're ready, we'll come out of that one. And those are the diaphragm or dantian holds. So for this next part, we're going to be working on the actual diaphragm. So I'm coming to the belly here. We're going to find the ribs. We go all the way up the midline. We find the xiphoid process. And then you can just, for landmarks purposes, trace the outside of the ribs on each side. Know where it begins and ends. Know what you're working with. So you can see I'm outlining her rib cage here. Okay, so this is something you're going to do on both sides. I'm going to demonstrate it on just one here though, but we can start by kind of hugging the ribs. So we have the floating ribs down here. That's where the base of my hand is going to relax into. My thumb is hugging up into the inside of the bottom of the ribs. And my fingers here are not going to be doing any work at all because I'm not going to press into the ribs. That's not very comfortable. But the work is going to be coming from the inside here. So the diaphragm is like an umbrella kind of canopy hugging underneath the ribs. And so we're going to help get it to move a little bit, because if it's moving, you know how it drops as we inhale and it goes up as we exhale. If it's stuck, that's going to increase the pressure, force, and overall energetic tension into our chest. So this can really help with chest tightness and when we feel anxious. We can open up our breathing muscle. So with this, what we're going to look like is just kind of rocking the ribs. And you can do this with both hands. I'm just demonstrating with one right now. You can stack your hands however feels pleasant to you. And you're just going to feel down the inside of the ribs. Feel where it's stuck, where it's sticky, crunchy, really crunchy. And then with two thumbs, you can stack your thumbs on top of each other to get more force. You're going to sink in. So I'm pressing kind of down and then inward. And it should not feel painful against the rib cage. So check in with your person. It might feel intense, but make sure you're not pressing on the bones. We want to go down and then under the ribs. And so we're going to do that and hold as she takes a breath in. And as she exhales, we're going to sink in a little bit more and hold. So we're creating a new minimum point. Breathe in. Sink in on the exhale. And one more time. Good. And coming out. Then work your way down to a new spot. So you can do like 3 breaths in each different area here along the ribs. Each time they breathe in, then you breathe out and you sink in with them. Working our way down. Inhale, hold, and exhale, we sink. Good, and then to end it, you can kind of do some scooping towards the belly button. Give it a little rub. And do the other side. So make sure we do both sides and see how that works, how your person breathes differently afterward. Really powerful technique. So giving you a view from opposite side, how it looks with two hands. So I'm cradling my left hand into her right rib cage, and my right hand is coming on top just as kind of a reinforcement here. And we're going to open up the ribs by kind of moving them side to side. And then sinking in with my left thumb. Again, right hand's just for reinforcement. And breathe in. Breathe in. Good, breathe in. It can be pretty intuitive. You don't have to do 3 breaths in each spot, but just feel it's tighter in one area, stick it there longer. If it feels like it's opened up, you can move on to a new spot. And I like to do, each time I move, I just kind of press the ribs away and then kind of wave them back to me, press and pull. Kind of helps everything connect together. Okay. So after you've done all of these techniques, a great way to end the session is to come back and just bring it all home with doing a few more pec presses. So finding your stability point, heels of the hands down, palms firm, and fingers, and just walk your way around the pecs underneath the collarbone. Settle the mind, settle the heart. Do that a few times, and then end with a little scalp scrub. Bring the body home into the head, clear the mind. That doesn't have to look like anything specific. Like scalp scrubbing is pretty intuitive. Just get all around there. Get behind the ears, under the head. If your person doesn't have hair, that doesn't matter. Go where there is balding. It still has fascia. It still has muscles and blood flow. It still feels really good to massage. Go into the forehead. Just end it. End it all.